Hi, I'm Dr. Bernard Rosenfeld, and I've been doing microscopic tubal reversal surgery now for 30 years. I was on the full-time faculty of the Baylor College of Medicine for 13 years, and at that time I received additional training from the Department of Plastic Surgery. I am a perfectionist, and I am attentive to every detail. I work at the Texas Medical Center. The Texas Medical Center is the largest medical center in the world. It attracts heads of state, kings, sheiks. I was honored for this work. One of them were from the United States Congress for the Special Justice Award by the Center for Law and Justice in Los Angeles. We have a free consultation either by email or personally by me to try to answer all your questions. We know this is an extremely important decision, and we want to assure you that there is an excellent success rate in general, and in particularly that we can give you the best possible success. I just do one procedure a day because using the very fine suture that I use, which is 10-0 nylon, which is indeed the finest suture made, the intensity of focus and the labor intensiveness of using such fine suture in a multi-layer closure, I always feel I can give you the very best success. We are never in a rush to finish the procedure. We have no time restraints. We do everything possible to make sure you have the finest closure, the smoothest closure, and also at the time we look for any other abnormalities to make sure you're not having to come back in a year or two for another gynecologic procedure. We feel it's very important to see you the day before and do a detailed pelvic ultrasound to look for small abnormalities or large abnormalities such as fibroids, which are not cancer but are smooth muscle masses that can cause gynecologic problems later, or if they become large enough, cause fertility problems later. We look for any abnormal cyst of the ovaries. During the surgery, we do a hysteroscope, which is a little telescope to look inside the uterus to try to find any abnormalities and for you to have one surgery and not having to come back 2 or 3 years later for another surgery. We feel probably the most important aspect of our surgery is using this very fine suture that would leave you with the smoothest closure and the least chance of adhesions. The type of suture we use really requires much more skill and labor-intensive work. The 10-0 is twice or 3 times indeed smaller than the 8-0 that most doctors use, or even smaller than the 7-0. This needle is smaller. The suture is much smaller, and mainly it's used by eye surgeons in general. And if you were having something that was going to be permanent in your eye, you much rather have the smallest suture that they make, which is 10-0, than a much larger 8-0 or 7-0. The smallest and finest needle you can have, then the less trauma you're going to have with any tissue that you're sewing together. We feel this gives you a more precise closure and gives you the lowest rate of having a tubal pregnancy later. These days, a tubal pregnancy can be treated by medical management. There are not any risks to people's health as long as they're found early, but obviously we much rather you have a live birth than a tubal pregnancy. We also use adhesion prevention materials such as this inner seed, which covers the tube to prevent adhesions later on. This has been approved by the FDA because even a very, very small adhesion for you could be the difference between a live birth and an ectopic pregnancy. We have a preoperative visit, which we feel is very important. We do a detailed ultrasound, and always sitting down and talking with patients, I always find one or two things different than when I talk to them on the phone. I'm under no time restraints. I will spend as much time as possible with you, and then I'll see you the day of the surgery, once again sitting down with you and your husband under no rush to make sure there's not any last minute questions. And then we usually see you the day after the surgery. And most complications with surgery can be avoided by patients being active right away as soon as possible after the surgery. We're not worried at all about our incision separating, about the tube separating. So we really encourage people to be active, get up, walk around, go shopping if they wish, but be as active as possible. With this on-cue paint pump, which is really state-of-the-art and is used at the most elite hospitals in the world, right here at the Texas Medical Center. MD Anderson uses it routinely. The Texas Heart Institute uses it routinely. Our patients and other patients have said it's really 21st century state-of-the-art surgery. It pumps local anesthesia into the wound for 3 days, and then the entire wound is essentially numb for 3 days. I'll give you 100% guarantee that if you look me straight in the eye and say, "Oh, I didn't think this pain buster was that good," I'll give you the $230 back in cash. We use very strong dissolving sutures and this Tegaderm dressing, which completely seals the dressing for 7 days. It seals it so tight that you can go showering the next day. You essentially can do whatever you want. It's easy for the patient to peel off after 7 days, or if the patient's around, then we're always glad for us to peel it off for her. We particularly don't like to talk about pregnancy rates because we feel they can be misleading. People can talk about pregnancy rates, but that's not take-home babies. These can include ectopic pregnancies, they can include miscarriages. So what we like to talk about is live birth take-home baby rates. And that should be well over 80% depending upon a woman's age, the type of surgery she had previously, her husband's health, her husband's sperm count at time, her husband's previous fertility history. But we look at all these factors, and I will check them personally and give you a personal free consultation to let you know what I feel your chances would be. In general, tubal reversal surgery in the United States and abroad, when done by trained surgeons who routinely make that part of their practice, does have a high success rate. It's significantly higher than IVF. It's much less costly, in the range of approximately $6,000, where IVF is at least twice that, and it gives you a much higher success rate, which usually just requires 3 visits. Any of the labs that we feel are necessary, actually the office pays for. So when we tell you this $6,400, and actually $6,000 if you don't want the on-cue paint pump, that is everything. There's not one nickel more. We don't charge you because of your weight. We don't charge you one nickel more for anything. I love still doing obstetrics, and I have limited my obstetrics now to my tubal reversal patients who are in the area if they wish me if they wish that I deliver them, and I also deliver now girls who I delivered 20 years ago, 25 years ago, 30 years ago. So it's usually a very happy obstetrical practice. After you go on our website, we really hope that you just give us a call and let us talk to you, walk you through the procedure, make sure you realize, okay, this isn't a dangerous procedure, this is very safe and really very little to worry about. We would do everything possible to give you the very, very best chance of success, the least chance of adhesions, and the very least chance of having a tubal pregnancy and having a successful pregnancy.